Good afternoon, everyone. My name is Harley Costing. Did you know that oral cancer usually isn't found until late stages, leading to invasive surgeries, procedures, and can even cause death? 355,000 Americans each year are diagnosed with oral cancer. Oral cancer can be on the mouth, oral cavity, or oropharynx. I am currently researching how you can catch oral cancer early for interventions. Oral cancer screenings can prevent and lead to early intervention of precancer and cancer. Today I will be talking about what an oral cancer screening is, how you can perform one at home, and what oral cancer can look like, and the early signs and symptoms. An oral cancer screening is a process that varies, and the dental journal states that you can have many different ways a professional can do an oral cancer screening on you. First, you can take pictures of your mouth and send it in to a specialist using a mobile app. The specialist will analyze the pictures that you send in, and if anything comes back abnormal, you will be sent to an on-site specialist. You can also go to your dentist, and your dentist can do an oral cancer screening. There's also a risk module by Harvard that allows for them to assess your lifestyle and see how that puts you at risk for cancer. Now that we've talked about how you can get an oral cancer screening app with a professional, let's talk about how you do it at home. Dr. Nischwitz says that it's all, in his book, It's All in Your Mouth, that if you want to live a healthier lifestyle, you have to start in your mouth. When you're doing an oral cancer screening at home, first you need to look in the mirror, and you need to assess your neck and make sure that it is symmetrical, has no discoloration, and has no lumps or bumps. You need to check for tenderness, and always check your Adam's apple. Make sure when you swallow it goes up and down and not side to side. If you have any hoarseness that lasts for more than 2 weeks, then you need to get checked by a healthcare professional. After you have checked your neck, you go to your oral cavity and your oropharynx. First, what you would do is get a flashlight, or you can get in good lighting and flip your upper lip and your bottom lip. What you're going to be checking for in these areas are any discolorations, changes in shape, or changes in swelling. You're then going to check the sides of your cheeks, the roof and floor of your mouth, your tongue, which you can just stick out and check the top and the bottom and side to side, or you can pull it out with a gauze. Make sure to check your sides of your tongue as well, because that's where oral cancer is mostly found. And then your oropharynx, which is the back of your throat and your tongue. Now that we have talked about how to do an oral cancer screening on yourself at home, we need to talk about what oral cancer looks like. Oral cancer is malignant and life-threatening. Precancer is going to be lesions that are precancer cells. They're not malignant yet, but they have the potential to become malignant. Signs and symptoms that you may have oral cancer are red or white patches, soreness of the throat when you swallow or whenever you speak, loose teeth that become loose suddenly, and any kind of lesion that consistently bleeds or does not heal. Also, if there are any abnormal lumps, bumps, or indentations. Now that we have gone through these facts of an oral cancer screening, I hope you see how detrimental oral cancer can be, but how easily it can be found if we stay vigilant. An oral cancer screening can and has saved lives. The next time you're brushing your teeth, I hope that you think of these steps and how you can see an oral healthcare professional that can do a screening. You can do an oral cancer screening at home, and I hope you realize the signs and the symptoms early on. Thank you.